I have a couple of coping strategies that I use when I'm going to the dentist. One is that I try and think of things that are going to happen after I see the dentist, and that makes it a bit easier because it means that it's not the end of the world. It's not that I'm going there and then the world stops. I also tend to try and take something in my pocket that I can touch while I'm at the dentist that reminds me that I'm not just a mouth and teeth, and that there's something else to my world other than just my head.
I think for survivors to cope with going to the dentist, it's important that they tell the dentist they're anxious and explain that they have had a number of incidents in their life that make them anxious about these sorts of procedures. I think if they know what it is that would make it easier for them, I think it's important that they make that really clear to the dentist too. And probably what they do need is a hand signal when they really are about to not cope at all, so that whether it's that they raise their left hand or they do something, so that the dentist knows to just stop for a few seconds and let them gather themselves.
I think one of the coping strategies that works really well for me is I will put coins in my pocket, and then I will feel the coins while I'm lying in the chair, and I will focus on the feel of those coins and try to work out what denominations they are, and then try to work out how much I've got in my pocket. And it just helps to take the focus off what's happening to my mouth and my teeth and stops me being aware of what the others are doing in the room. Another coping strategy I have is that I always make sure I plan something nice to do after the dentist. And then this is something for me to look forward to and to think about while I'm in the chair.
Yeah, I do. I do have some coping strategies for where I go to the dentist. When I ring and I book my appointment, I let the staff know that I want plenty of time allocated for my appointment so that whoever I'm seeing can spend time with me, that I don't want to be rushed. I have specific needs, as in whether I want to see a female dentist or a male dentist, depending on how I'm feeling at the time of when I'm scheduling my appointments. I do see both because sometimes seeing a male dentist is not good for me because my perpetrator was a male, so I'm very aware of that. And I just try really some deep breathing, relaxation techniques, and I let the staff know how I'm feeling on the day. I think the most important thing for me is letting the staff and the team that are working with me in my dental appointment know how I'm feeling on that day. I might have a good day, I might have a not so good day. So if I'm not having a good day, they can then step up and be more supportive to my needs. So it becomes about me as the patient and not me just as a number to the clinic. So yeah, that's how I tend to cope. I just let them know how I'm feeling, and deep breathing and try relaxation.
My main other coping strategy is just to go through it, just to tell myself that I'm only there for a short amount of time and that it's going to end soon, and that then I'll be back to my normal life again once it stops.